Hello, this is Dr. Thomas Dobbs, and this is a 3-minute COVID public health update for August 3rd, 2021. We are seeing that the Delta variant is driving up cases, hospitalizations, and deaths. You can see that we're now averaging over 1,700 cases a day and over 131 new hospitalizations per day. This is far exceeding our hospital's capacity to take care of them, again, seeing additional stress upon the healthcare system. If we look at where we are on ER visits compared for the rest of the previous parts of the COVID pandemic, we are actually seeing more emergency department visits for COVID than we have for any time throughout the entire pandemic. One of the things that's very different is with our hospitalizations, we are seeing an increasing proportion of younger individuals, especially those who are less than 50. If we look at people who are like 40 and less, we're seeing about a third of hospitalizations are in that age group, which is very different for Delta. With the previous pandemic, part of the pandemic, it was mostly older folks, but now we're seeing more and more people who are in younger age groups. And these are people who are very seriously ill in the ICU on life support. And sadly, many of these folks may not make it out of the hospital. We are still seeing that the vast majority of cases are in unvaccinated folks. 97% of all new cases are in the unvaccinated. If we look at hospitalizations, 89% of hospitalizations are in the unvaccinated and 85% of deaths are in the unvaccinated. As you can see, within this 15%, these are folks who are vaccinated, but by and large, these are older individuals and people who have weakened immune systems. And we're still working to see what we can do to promote and make booster doses available so that we can help prevent some of these very, very sad losses of life. If we look at over time, you can see pretty clearly that looking over the past couple of months, the vast majority of cases have absolutely been in folks who are unvaccinated. And you can imagine if all of these folks had been vaccinated, we'd be looking at a very different situation in regards to the Delta surge. We have had some good news over the past couple of weeks. You can see that we've more than doubled our weekly immunizations against COVID compared to a few weeks ago. So we're very excited that many Mississippians are heeding the call to get the vaccine to protect themselves and to protect their families from this deadly Delta surge. I just have one other thing I want to make sure people remember. If you are diagnosed with COVID, remember that monoclonal antibodies are effective at preventing hospitalization and improving survival rates of COVID. So if you get COVID, talk to your doctor. Monoclonal antibodies are an infusion or a shot you can get in the clinic that are basically antibodies that will attack COVID so that you don't get so sick. We have a network of 41 different centers of excellence that provide this, in addition to other clinics and hospitals that do it as well. To qualify for monoclonal antibodies, it's really up to your doctor. There are a whole host of medical conditions, but anything from being a little bit overweight to having diabetes and that sort of thing. But these are widely available now, and we know that they're very effective, and really your doctor can give them to you for any reason that they deem appropriate. So please talk to your doctor about monoclonal antibodies.